Welcome back. Ozempic microdosing is becoming popular, but is it safe? Dr. Judy Corner is an endocrinologist and professor at Columbia University and joins us live to talk more about it. Welcome to Houston's Morning Show.
Thank you. Glad to be here.
So happy to have you with us. Can you explain, first of all, what microdosing is so we better understand that, and then why a patient would consider doing it?
Well, honestly speaking, microdosing is not really an accepted terminology or even an accepted dose when Ozempic is used properly. It seems that some physicians or healthcare providers may be trying to give patients smaller than the FDA-approved dose. And we would have to really question why that is happening. So Ozempic, as many of us know, comes as a pen, and you dial up the dose that you need when you start the medication. And the lowest dose is 0.25 milligrams. Now, if you have to go below that dose, the question is it because you're having severe side effects? Or is it that maybe Ozempic is not the right medication for you? Maybe you're losing too much weight and you never should have been placed on Ozempic to begin with. So I think we really have to question what is going on in people who are prescribing or using smaller than the recommended dose.
Now, would your concern be for weight loss or for somebody who has diabetes? Because it gets confusing with all of these drugs now and who's using them for what reason.
It's extremely confusing. So, and in part, there are different forms of what Ozempic is. So Ozempic, the generic form of it is semaglutide. And that came out originally to treat diabetes, but people started losing, a fair amount of weight. So semaglutide was then tested on people without diabetes for weight loss. So the weight loss form of semaglutide is Wegovy. They're identical. Ozempic and Wegovy are the same medication, just comes in different pens and different doses. Whether you use Ozempic for diabetes and you're losing weight, or whether you're using Wegovy just for weight loss, you'll get the same effects. It just depends on usually what your insurance will cover and whether or not you have diabetes. So I would say if someone is using smaller than the recommended dose, maybe they're using it for weight loss. And if they're losing too much weight, then my guess is maybe they shouldn't have been on Ozempic to begin with.
All right. Dr. Corner, thanks for taking time from Columbia to talk with us today. So it's such an honor to be able to get your expertise on this. Thank you.
My pleasure.